Hello everyone, this is SHARMIA. In this video, we are going to see about what is meant by wound healing. First of all, a definition. Wound healing refers to the body's replacement of destroyed tissue by living tissues. It can be achieved by two processes. First one is tissue regeneration and second one is scar formation. Dynamic balance between these two is different in different tissues. Yes, wound healing means it's a body's replacement. If when we get injured in some conditions, our some tissues will get damaged, right? In the surroundings there will be like healthy tissues. This healthy tissues will replicate and replace the damaged tissues, and it is should be yes, cell regeneration and scar formation. Sometimes the scar will be formed, and that damaged tissues, new tissues will be replaced, and there will be scar formations. Scar formation is different based on different tissues. Introduction to healing. A complex cascade of cellular events occurs to achieve resurfacing, reconstitution, and restoration of tensile strength of injured tissue. Yes, this newly formed tissues will not. There will be a restoration. Healing will be a reconstruction, restoration of the the normal tissue. Normal tissue strength will be replaced by the replicated tissues. Wound healing is occurs in three processes. One is inflammatory process, second is proliferation, next one is remodeling phase. Stages of wound healing. When we get injured, we will start bleeding. The area get bleeding, and blood clot will be formed in that area. Then some WBCs, RBCs, platelets will come and form blood clot, and inflammatory mediators will be generated, released from the nearby injured areas, and next only proliferation. Then healthy cells start to proliferate. Then remodeling. The old injured tissues will be replaced by the new healthy tissues. This all happen in the wound healing process. First one is inflammatory phase. Inflammatory phase takes place in 2 to 5 days. Hemostasis, there will be vasoconstriction, because in the injured area the blood vessels will start to leak out. During that time, vasoconstriction, the blood vessels start to constrict. Constriction cause reduced bleeding. The bleeding will be stopped. Hemostasis is achieved. Then blood block is achieved by formation of the platelets, anti-intrinsic and extrinsic clotting factors. Clotting factors will will stop the bleeding by forming a blood clot. Then formation of a provisional fibrin thread will be formed. Recruitment of inflammatory cells into the wound by potent hemoattracts. Inflammatory cells also comes to that area by releasing the inflammatory mediators, which get released from the injured tissues, and most of the inflammatory cells will reach that injured area. Early events in inflammation. Fibrin and fibronectin form a lactase that provides a sac-fold for migration of the inflammatory endothelial and mesenchymal cells. Fibrin and fibronectin forms will start to attract the inflammatory endothelial and mesenchymal cells. Neutrophils also infiltrate the apis. Neutrophils will remove the dead tissues and prevent the infections. Monocytes, macrophages will also follow. First mediators are the neutrophils, first responders. They will reach the injury site early, and they will remove the dead tissues and prevent the infection. Following this, monocytes and macrophages will follow neutrophils. They will provide phagocytosis. Phagocytosis means it will engulf the dead cells or bacteria present in the injured area. Late events in inflammations means entry of lost lymphocytes will enter there, then appearance of mast cells will appear next in late process only. Next one is proliferative phase. In proliferative phase takes place in 2 to 3 weeks. Next, granulation tissue will get formed. Angiogenesis, blood vessels get formed. Next, contraction means wound get pulled, so that this end of the tissues and this end of the cells will pull together and the wound gets smaller. Epithelialization means epithelial cells will also migrate to the new injured area, and it will form the new tissues to replace the older damaged tissues. It's mesenchymal cell proliferation. Fibroblasts are the major mesenchymal cells which involved in wound healing. Other small the mycelial cells are also involved. Macrophages products are chemotactic for fibroblast, platelet derived growth factor, endothelial growth factor, and interleukins 1. So these are the inflammatory mediators which also released, and it will replace the replace a provisional fibrin matrix with the type 3 collagen will get formed in this phase. Angiogenesis means reconstructs the damaged blood cells will construct, and cytokines also released. Next, more inflammatory mediators get released. Next, epithelialization. Epithelialization means epithelial cells will get together and the new cells will be formed in this phase. And last one is remodeling phase. It takes 3 weeks to 2 years. First formed collagen is type 3 collagen. It will be formed in the early phases of the cell enduring. During that collagen is somewhat less effective than the normal collagen, so that it is replaced by the type 1 collagen, type 1 collagen. Then type 4 collagen are based on the injured areas. Collagens will be regenerated. Next, remodeling. The number of intra and intermolecular cross links between collagen fibers increased dramatically, a major contributor to the increase in wound heat breaking strength. Quantity of type 3 collagen decreases, which is the quantity, the type 3 collagen is replaced by the type 1 collagen. Remodeling continues for 12 months, so scar revision should not be done prematurely. Next one is wound contraction. Begins approximately 4 to 5 days after the cell injury, generally which occurs in the large surface wounds. Represents centripetal movement of the wound edge towards the center of the wound. Maximal contraction will occur in 12 to 15 days, although it will continue longer if wound remains open. Yes, if the wound remains open means the wound pulling will happens, and wound get smaller. Next, wound edges move towards each other at an average rate of in which rate the wound will get contraction means 0.6 to 0.75 mm per day. Wound contraction depends on the elasticity of the tissues. Bucktuck movement will contract faster than the wound on the scalp or peritibial area. Yes, in the scalp area, buttocks wound will contract more faster than compared to scalp area. Yes, based on the tissues elasticity. Wound shape also affect. Square is faster than circular. Square shaped wounds, where are square shaped wounds placed means thus wounds will contract more faster in compared with circular type of cells presented wounds. Then wound strength. Skin wounds at the end of the first week, wound strength is approximately 10% of the unwounded skin. Wound strength increases rapidly over next 4 weeks and then slows down at approximately at third month, reaches a plateau at about 70 to 80% of the tensile strength of unwounded skin. Scar tissue is never strong as the original tissue. Yes, the later formed tissue, scar tissue is not as much as strong than the old healthy tissues. Uh, Important growth factors which are responsible for wound healing are platelet-derived growth factors, which promotes migration and proliferation of the fibroblast. Is also chemotactic the monocytes. Next one is epidermal growth factor, which promotes the growth of endothelial, epithelial, and fibroblast. Next is fibroblast growth factor, which promotes the synthesis of ECM proteins, including fibronectin. Chemotactic for fibroblast and endothelial cells promotes angiogenesis. Vascular endothelial growth factor, which helps in angiogenesis. Macrophage derived growth factor, interleukins 1 and TNF alpha, which promotes the proliferation of fibroblast and endothelial cells. Wound healing is accompanied by two waves. First one is healing by first intention, the primary union, and the second one is healing by second intention, secondary union. First healing by first intention, which occurs in a clean and incised wounds with good opposition of the edges, particularly planned surgical. Mostly this first intention occurs in a clean wound, surgical wounds, no infection presented wounds. The incision causes only focal disruption of the endothelial basement membrane continuity and death of the relatively few epithelial and connective tissue cells. As a result, epithelial regeneration predominates over fibrosis. Healing by first intention sequence of events. First one is immediate, the narrow incisional space. This in the image they have shown that like this wounds will filled by fibrin clotting factor and dehydration at the surface produce a scab to cover and protect the healing repair site. This type of wounds will get healed within 24 hours. Movement and proliferate. Epithelial cells will proliferate in the area and the continuous epithelial layer will be formed. Early inflammation and closes of the edges will take place by neutrophils which prevent the infection. As 2 to 3 days, the neutrophils will be replaced by primary responders will be neutrophils. Next, later they will be attracted by macrophages. Macrophages remove the blood clot and continuously proliferate the epithelial cells and fibroblast activity. Within 10 to 14 days, scab gets loose, epithelial covering also completed, fibrous union in stages, wound still weak, but wound will be still weak. But by the end of the first month, the scar will be formed. Dermal appendages destroyed at the line of the incision are permanently lost. Tensile strength of the wound also increases. And this is the healing by first injection. Second injection, this occurs in the open wounds. Like regeneration of the parenchymal cells cannot completely reconstitute the original architecture. Abundant granulation tissues grows in from the margin to complete the repair. Granulation tissues consist of macrophages, neutrophils, new blood cells, and firstly, the cavity will filled with blood clot. Acute inflammation will be takes place in that area. Within a few days, there will be a contraction of wound size. New capillary loops also formed. Scab dries out. In the first week, a scab will get shed. Epithelial cells get proliferation. Loose connective tissue will be formed. Capillary loops granulation has begin. 2 week onwards, collagen arranged Collagen fibers are also formed. Capillary fewer cells, epithelial covering also completed. Once there will be a depth of the depression surface will be varying. Thick collagen will be formed. Full thickness of epithelium also restored. This is the secondary. Primary, in that first primary means likely cut wound. There will be easily epithelial gets proliferate and white scar will be formed. But in secondary intention there will be a open wound, long open wound. It takes more time for healing. Secondary union differs from primary union in several respects. Inflammatory reaction is more intense in secondary union. Larger amounts of granulation tissue has to be formed. Larger scar has to be formed, and wound contraction also long as compared to that one, primary union. Factors which are influence the wound healing. There are several factors which can speed up or delay wound healing and are classified as two. First one is local factors which occurs in the wound site, and second one is systemic factors affecting the whole body. First one is first we can see the local factors. There are several factors which directly delay the wound healing at wound site. First one is infection. It's the most common cause. How it affects healing means bacteria will enter the wound, inflammation will get increased, more tissues will get damaged, collagen breakdown and delay healing. Next one is poor blood supply. In that, reduced blood supply, less oxygen and nutrients reach the wound, and fibroblast activity also decreases, collagen synthesis decreases, delayed healing. Next one is foreign bodies, grass, dirt, dead tissue, sutures remain in the wound, which persistent inflammation, impaired tissue repair and delayed healing. Next one, mechanical stress or excessive movements. Frequent movement of the wound, newly formed tissue get disrupted, wound edges will separate and healing slows. Next one is edema, swelling, fluid accumulation around the wound which increase the tissue pressure, reduced oxygen supply and delayed healing. Next one, size and site of the wound. Large wound means more tissue to replace, so longer wound healing time. Next, poorly vascular areas means cartilage, tendon areas will poorly vascular areas, which there will be less blood supply, less oxygen supply. Next, slow healing. Next one is systemic factors. This includes this will affect the entire body, which are indirectly influence the wound healing. First one, age. Increasing age reduce the cell proliferation and which reduce the collagen production, lower healing. Next, nutrition, protein, vitamin C, zinc, this will reduce the collagen synthesis. Next, poor tissue formation. Next, delayed healing. Protein will needed for collagen formation, vitamin C for collagen maturation. Next, zinc for cell proliferation. Diabetes means high blood glucose means poor blood circulation, reduced neutrophil function, reduced infection risk, increased infection risk and delayed healing. Smoking, nicotine causes vasoconstriction, decreased blood flow, less oxygen delivery, reduced collagen formation, delayed healing. Anemia, low hemoglobin, reduced oxygen transfer, less oxygen reaches wound, delayed healing. Corticosteroids suppress inflammation, reduce fibroblast proliferation, reduced collagen synthesis, delayed healing. Chronic diseases mean heart diseases, kidney disease, cancer, which will reduce the oxygen and nutrient supply, impair the immune response, delayed healing. These are the factors influencing wound healing. Then complications of wound healing. Wound healing may become abnormal, leading to three major complications. First is deficient scar formation, excessive formations of repair components, exaggerated contraction. First one is deficient scar formation. What is this means? The wound fails to pursue enough collagen or granulation tissue, resulting in the weak scar. Poor healing, pathophysiology, poor healing, inadequate collagen deposition, weak scar will get formed and wound breakdown and reopening. Example, first one example is wound dehiscence. In that, partial or complete reopening of a surgical wound, which is caused by infection or poor nutrition, which weak scar is formed, wound edges will get separate, wound dehiscence. Then second one is ulceration. In that, failure of wound to heal completely. Common in diabetic foot ulcer, venous ulcer, pressure sores. In this, poor blood supply or infection will cause tissue destruction, and persistent opening of wound will get formed ulcer formation. Second one is excessive. This is the wound dehiscence. Second one is excessive formation of repair components. In that, excessive production of collagen and connective tissue will formed during healing. In this, the pathophysiology is excess fibroblast activity, excess collagen deposition, and large scar formation is happen. Example, the two examples. One is hypertrophic scar. In that, excess collagen form but remains within the original wound boundaries. It will occurs only in the original wound boundaries, but there will be excess collagen formation. Feature raised wounds, red and thick, may regress over time. Yes, flow excess collagen, raised scar, hypertrophic scar. Second one is healite. Healite means excess collagen extends beyond the original wound margin. This features means large raised scar, continuous growing, common on earlobes, chest, soldiers. Next flow chart is excessive fibroblast activity, massive collagen get deposits, scar beyond extend beyond the wound area. This is a healite. Next one is last one is exaggerated contraction. It means excessive wound contraction due to the overactivity of the myofibroblast. In this excess myofibroblast activity, which leads to excess wound contraction, tissue get deformed, restricted movements. Example, contract. Permanent tightening of the skin, muscles, and joints will cause due to the excessive scar contraction. Common in severe burns and large wounds. So that burn or large wound, excess contraction, skin tightening, joint movements also restricted, contracted. Okay, there are three complications. First one is deficient scar formation. It will be due to too little formation of collagen, dehiscence and ulcer. Excessive formation of repair components means too much formation of this hypertrophic scar and keloid. Exaggerated contraction means too tight contract. Okay, that's all. Let's see once again what we have learned up in wound healing. First, we have learned what is meant by wound healing. We know the replications of the healthy tissues in the affected replacement of the damaged tissues by healthy tissues is meant by wound healing. Next is we have seen about the stages of wound healing. There are three stages: inflammatory phase. There are inflammatory phase, proliferative. Next one is remodeling. Then we have seen about important growth factors in the wound healing. As we have seen wound healing, healing by first intention and second intention. We have seen the sequence of events which happens in that two phases. Next, we have seen the factors that influence the wound healing. There are two: it's systemic, local. Systemic, there are in systemic there are age, nutrition, diabetes, smoking, anemia, corticosteroid therapy, chronic diseases and all. In that local, we have seen infection, poor blood supply, foreign bodies, mechanical stress, edema, size and site of the infection. Next, we have seen the complications of wound healing. There are three: deficient scar formation, excessive formation of repair components. Then last one is exaggerated contraction. Deficient scar formations means too little collagen formation. Excessive formation of repair components means more collagen scar formation. Exaggerated contractions means too tight scar is formed so that contraction is restricted. This is what we have seen in the wound healing. Thank you.